Hi, welcome to week 5, your fully online week. And does this mean you have to spend Monday of Thanksgiving holiday doing this? Absolutely not. This is the lovely bit of online learning, is you can tackle this in week 4 if you want, and you will want to look at it before our midterm exam. And I'll talk about that in detail in class, because I fully realize that there's a little bit of insecurity with learning online, and then the expectation about what the depth of learning and that type of thing. So week 4, I will spend about 10 minutes talking about the midterm exam and specifically address this online work. But moving along, the online portion is formatted so it'll be fairly easy for you to just kind of scroll through answering some questions. And I'm a little bit all over the place. I start you with the Lewis text readings, and I'm pretty specific about what I want you to pull out of those readings. And I often take you on some little side trips or sidebars if you're a legal type, where I just want to have a quick look at why we're focusing on something and why it might be important in your nursing future, basically. So the learning is huge when we look at the immune system, and I want you to realize that some researchers spend their entire life work on the immune system, and so we have a week to really delve into the alterations in the immune response. So I'm starting you with a background in the immune system, and I want you to start recognizing some cells that are going to be very important to follow along, and in lab reports I want you to recognize, I'll give you an example, immunoglobulins IgE or E antibodies are important in the sense that they are raised in allergic conditions or in parasitic infections. So that's something really tangibly important for you as a nurse, to be able to look quickly at an immunoglobulin, an antibody screen that is coming back on your patient, and recognize that we more likely have a sensitivity than we do have a microbial infection. Does that make sense to you? And likewise with viral infection, I want you to have a sense of being able to predict and to understand what is going on with your patients. So with the background that you're getting on the immune response, I really have targeted that background to a background that you can pull right through into the clinical area. I also want you to have a familiarity with one hypersensitivity response and one autoimmune illness. And we'll look at, again, these are huge fields of inquiry, and we are certainly not in a week going to have you grounded in any sense in those two topics. But by looking at an example, you'll get a pretty clear idea of how the alterations in the immune response tie into your knowledge of the immune system, of inflammation, perhaps of the stress response, and that is extremely valuable because, again, it pulls together the work that we've done this fall. So, onward and upward. I hope that you'll progress through this along with my recommendations, and I say that not out of vanity that I've put together this amazing lesson, but out of time management for you. I think that you will actually spend less time if you kind of follow along with me and the rest of the class, and use the recommendations for the level of or the depth that you're going to do your reading and your pulling together of information. Thanks, good luck. I'm available always by email, you know that, and on office hours as well, but please send an email at any point with questions, or even better yet, please, you could put it on the questions for the instructor, and anonymously if you like, and I will do my very best to explain that section that you're struggling with. Okay, thanks very much, and see you soon.